So you have COPD, or chronic obstructive pulmonary disease, and you are wondering about lifestyle changes that will help your symptoms. You might be in what is known as the contemplation stage of behavior change. You may have considered making a change, but don't feel ready to do so. This might be the case for several reasons. COPD can be a difficult condition to manage, as people have difficulty exhaling because the airway has become narrow, resulting in air trapped in the lungs. The task of coping with COPD can appear daunting, but don't be discouraged. Healthy People 2020 states that COPD is treatable. COPD symptoms and quality of life will improve with many small lifestyle changes. Exercise and nutrition are important health-promoting behaviors that are not addressed enough during education of COPD patients.
Exercise. Regular physical activity is a vital component of healthy living. Exercise has positive effects on the health and well-being of COPD patients. Doing simple exercises 3 times per week for 20 to 60-minute sessions improves both breathing and quality of life in COPD patients. With targeted exercises, patients reported feeling less short of breath, improved emotional function, less fatigue, and a feeling of mastery at participating in and engaging in the exercise programs. Here are some exercises you might include in your routine when considering adopting a physical activity plan. Walking, cycling, chair exercises, and 1 to 2 pound free weight exercises.
Nutrition. Knowing how to go about making dietary changes and eating a balanced diet can be difficult. Those with COPD might find themselves getting too tired to prepare meals or food that just doesn't taste as good as it used to. While dietary changes can be challenging, maintaining a well-balanced and nutritious diet is essential in order to get the necessary calories your body needs to function at its best and help manage your COPD. A healthy diet is especially important for those with COPD, as it provides enough energy for the increased work of breathing, helps prevent lung infections, and helps prevent malnutrition or unplanned weight loss from poor eating. Inflammation, swelling, and mucus associated with COPD causes the airway to become obstructed, and breathing is often a challenge. As the airway itself becomes narrow, coughing to move secretions can also become problematic. COPD symptoms such as difficulty breathing, loss of appetite, and psychological factors in combination with poor accessibility to nutritious food items and taste changes due to medication side effects place those with COPD at a higher risk for malnutrition. Being underweight can be a serious problem. While you aren't getting enough calories, your body breaks down fat and muscle, causing your muscles to become weak. The increased effort of eating can add shortness of breath. This can lead to decreased appetite and further weight loss.
Here are some tips to make eating easier and improve your appetite. Make foods easier to chew by cooking them until they are soft, and mincing up harder to chew food items. Improve your appetite by creating a pleasant eating atmosphere. Add soft music, don't discuss stressful topics at mealtimes, and eat some of your favorite foods. Rest up for 30 minutes before meals. Sit upright and lean forward with your elbows on the table. Place feet on the floor and give yourself the greatest expansion of your lungs. Decrease fatigue by eating 6 small meals instead of 3 big ones. Its digestion requires energy, which requires oxygen, and eating smaller meals can use less oxygen. Use easy-to-make recipes and ask your family and friends for help. Important nutritional guidelines for COPD. Protein is one of the important ones, as it produces antibodies that fight infection. A lack of protein can reduce the lung's ability to fight infections. Try lean meats, fish, eggs, and legumes as good sources of protein. Drink enough fluids to help thin and clear out lung secretions, keep you well hydrated, and prevent constipation. Water is the best choice. Try low sodium or low salt foods to decrease blood pressure or shortness of breath. If taking corticosteroids, increase calcium and vitamin D for optimal bone health.
Now, armed with the right information, you are ready to make a change and start reaping the benefits that regular physical activity and sound nutrition
Will provide.
Created using Powtoon.